All right, we're going to go ahead and get started today. I want to welcome everybody who is in attendance for our webinar on the 2023 County Data Book for Kids Count. My name is Sarah Vanover, and I'm a Policy and Research Director here at Kentucky Youth Advocates, and my research and data team gets to do a lot of hard work on our county data book, and so we're really proud that we get to discuss this with you today. I just want to do a couple housekeeping things. We're going to have different people presenting on some of the data that we're going to be sharing. If you have questions, if you would just put those into the chat, and we'll try and review those and answer questions as we can. And we have a lot of people that are on the call today, so we don't want to interrupt anybody who is speaking. Just kind of keep that in mind. And then if we have extra time at the end, we'll allow for some questions there in order to answer anything that we haven't already. So if you haven't already, you can go ahead and put your name and the organization that you're with into the chat just to let us know how things are going. And we're going to get started with our presentation. If you want to move to the next slide. So we want to start off today by thanking our sponsors. We have 4 major sponsors that have helped us put together this year's County Data Book. That is Aetna, Better Health of Kentucky, CoSares for Kids, Charter Communications, and Mountain Comprehensive Care Center. And this year's data book would not be possible without them. So thank you very much to those organizations for your support of this year's Kids Count book. So I want to tell you a little bit about Kids Count. Each year, there is national Kids Count data that is presented, and that comes out in July through the Annie E. Casey Foundation. And then later in the year, each state does their own individual deep dive into their state data and into county by county data. So you can see where you live in Kentucky and how it is comparing. KYA is the Kentucky Kids Count partner organization, and we're grateful for our partnership with Annie E. Casey Foundation to help make this possible. The book really looks significantly at 16 factors that affect children and having a better life, having better outcomes in Kentucky. We kind of break those down into 4 areas, and they are classified by education, health, economic security, and that might include housing, secure food sources, childcare, and then also our final category is family and community, and that can include things like child welfare and the juvenile justice system. So those 16 indicators we look at the state level, we look at each county, and we also look at whether we have improved in those areas over time or there's been a decrease. Next slide. So this year, we always have a theme to the Kids Count book, and this year what we've really focused on is the kids sector workforce and all those individuals that make life better for children by working with them so diligently. This is our school teachers, our child care educators, our juvenile justice workers, social workers, everybody who's in the trenches working with kids on a daily basis. One thing that we've heard from people in these fields over the past several years is that staffing and finding personnel has been an extreme struggle. Everybody is looking for additional people that can work with our children to make sure that their outcomes are better, not only that they're healthy and safe right now, but that they're going to be healthy and safe in the future as they become our next workforce. And so the book really focuses on what the challenges are to staff those fields and even problem solving about what we could do to help individuals in those fields, to help bring more people into the field. How do we get more teachers in our classrooms? How do we find more child care providers? How do we make the workplace safe and also beneficial for our employees in the juvenile justice system? How do we make our social workers feel like they can work in the field and also support their own families? And just taking a look at what we think our legislative members and our governor need to know in this area so that we can continue to make Kentucky a better place for our kids. We're going to take a look into these 4 different areas today. And so I'm going to be passing the floor over to my colleagues so that they can tell you a little bit about these 4 different areas like education and health. So I believe Corinna Cash is up next to speak with you.
We have a youth who is going to talk a little bit about our Youth Forward before I get to dive into the economic security and education sectors.
And I think that she's just having some audio issues with Zoom. So we will circle back if Lexi's able to join a little bit later. So Karina, you're welcome to get started.
Awesome then. Well, I can cover this one real quick then. So looking at the child population across Kentucky, we know that about 1 in 4 Kentuckians are kids. As you see on the graph, it's a pretty diverse state. We have it broken down by race and ethnicity. And we have this available on our website where you can look at your individual county to see how many kids are in your county, as well as the racial makeup of the kids in your county. Next slide. So moving to the next couple slides, I'm going to spend the next couple of minutes talking with y'all about economic security and education, and then pass it over to my colleague, Alicia, to talk about our health and family and community sectors. So starting with economic security, we cover the indicators around children living in a household with a high rental cost burden, children living in food insecure households, children in low-income households, and children in poverty. Much like the child population, you can view county level data for all of these indicators, as well as a lot more indicators at our data center, which you can find at kyouth.org. So jumping in order to afford housing, food, childcare, and other necessities, most Kentucky families need to make an income of at least 200% of the federal poverty line. However, in Kentucky, 43% of children live below this line and often struggle to afford their basic needs. Living below this line puts families at risk of things like food and housing insecurity, which we highlight in our book. And we find that 15.2% of Kentucky kids live in a food insecure household, and 44% of Kentucky kids live in a household with a higher rental cost burden. As you can see on the screen, this high rental cost burden is something that we highlight in our divider pages. We know that a substantial number of kids and families are struggling to pay rent, with some counties reporting as much as 68% of their renters being housing insecure. While we know that wages have increased for many sectors in Kentucky, the cost of rent and housing has risen more than the wages that folks are getting paid. There's a lot of reasons why rent has gone up so much and the cost of housing has gone up so much, but we know a major factor in this increasing rent is the limited supply of housing across the Commonwealth. Research suggests that Kentucky needs, for sure, more than 89,000 units of housing, and recent natural disasters in the east western parts of the states have only made this shortage of housing worse. To address this problem, Kentucky can take steps to invest in building new houses, such as through investing in established streams and sources of income, such as the Affordable Housing Trust Fund, as well as taking steps to incentivize new development in communities. Building new housing not only lowers the housing cost for Kentucky families, but it's also a huge boost to Kentucky's economy and provides a ton of local jobs. Building 100 single-family homes generates an average of $28.7 million in local income, $3.6 million in taxes and revenues, as well as creates about 394 local jobs, meaning that building housing is not only a good investment for Kentucky families, but also for local economies and communities. The next divider page focuses on the cost of availability of childcare, as well as the workforce support that childcare provides. Very much like housing, kids need a safe place to live and grow, and very young children need one that parents can trust while they're at work. For many parents, that safe place for their young child to go when they're at work is childcare. However, we know that a year of infant care currently can cost as much or more than a semester at WKU. This often puts low-income families in a really difficult spot, particularly single families, where they cannot afford the childcare needed to go to work, but they also cannot afford to not go to work. In addition to the high cost of childcare, it is really hard for families to find childcare in a lot of our counties. 79 of Kentucky's 120 counties are considered childcare deserts, meaning there are less childcare slots available than families who need them. Even families who can pay out of pocket for childcare or those who qualify for assistance through programs like the Child Care Assistance Program struggle to access the childcare they need simply because it's not there. This can make it really difficult for young families of young children to maintain employment. And as you can see on the, if you go through the book, 1 in 9 Kentucky families have had to quit their job or adjust their work schedules due to issues with their childcare. The childcare sector received significant federal pandemic funding and support from that pandemic funding in the last couple years. However, we know that federal pandemic funding is starting to dry up. So to address the childcare crisis and increase affordability and access, we are calling on the state and federal government to invest money into the childcare sector to sustain the increases in affordability and wages that federal funding has allowed for. Moving on to the next slide. Perfect. So looking at our education indicators, you can see that we cover data around kindergarteners ready to learn, 4th grade students proficient in reading, 8th grade students proficient in math, and high school students graduating on time. As with the economic security indicators, you can view this data as well as county level data for each of these indicators and more at kyyouth.org. So we know one thing that we've heard a ton about here at KYA, and I'm sure a lot of you all have heard about, is pandemic learning loss. And we know that many of the education sectors took a big hit from the pandemic. That's why we're really excited to report that 2 of our indicators, 4th graders scoring proficient or higher in reading and high school students graduating on time, improved during the 2022-2023 school year. However, our other 2 indicators either stayed the same or got worse. So looking at 8th graders who scored proficient or higher in math, we see that only 36% of Kentucky's 8th graders scored proficient and higher in math, which is the same as the number of 8th graders who scored proficient the previous school year. Looking at our final education indicator, we saw that less kindergartners were ready to learn last year in comparison to the 2017-2018 school year. There are a lot of factors contributing to this decrease in kindergarteners ready to learn, but we know one of them is childcare, which we just highlighted. The first 5 years of life is a very crucial time of development, and as we highlighted in the economic security section, childcare in Kentucky is both unaffordable and accessible for many families. This means that many children across Kentucky are locked out of the social, emotional, and educational resources that childcare often provides. So moving on to the next slide. Our divider pages this year, we highlighted 2 crucial non-academic supports that we know improve the educational outcomes of Kentucky students. One is the school meal programs, which serve nutritious meals to kids all across Kentucky. We will not be going over this page in the webinar, but you can view this page and hear from a middle schooler in Fayette County about his experience with free meals if you visit kyyouth.org. Our other divider pages focus on after-school care programs. Excuse me. Much like childcare, Kentucky's 1,500 plus after-school programs provide school-age kids with a safe place to go in that time between when kids get out of school and parents get off of work. In addition to providing kids a safe place to go, these programs provide kids with a place to play, get a head start on homework, and can improve their social and emotional skills. However, a limited number of after-school programs and issues recruiting and retaining employees mean that many programs cannot operate at full capacity, and many communities do not have access to these programs. Currently, there is only 1 after-school slot for every 4 children who need after-school care. Much like childcare, the after-school care sector received a really big boost with that federal pandemic funding, but like I said earlier, that funding is running dry. To ensure that school or after-school programs can continue offering higher wages and more affordable care, we need the state and federal governments to invest in all child care providers, including our after-school programs. And that is all I have on education and economic security, so I will pass it over to my colleague Alicia Watley to walk us through the health and family and community sections.
Thanks, Corinna. So, hi everyone. My name is Alicia Watley. I'm with Kentucky Youth Advocates, and so I want to talk a little bit more about the second two domain spreads in the book. So, the first one here we have health, and as you can see, the 4 indicators that we look at in the health sector are smoking during pregnancy, low birth weight babies, children under 19 with health insurance coverage, and teen births. So we saw a couple of these that have improved since the last data period, as well as one that has remained the same and one that is getting a bit worse. So we are seeing some improvements in the number of women who are smoking during their pregnancy, as well as teen births that are occurring in Kentucky. And that follows a national trend that we're seeing on teen births going down across the country in almost every state. So Kentucky is in line with that trend. And then since the last reporting period, we've seen the number of low birth weight babies in the states stay the same. And of course, there are a lot of factors that go into what causes low birth weight. And one of those is smoking during pregnancy and other health conditions that can impact birth weight of babies. And so the one indicator in the health sector that we're seeing decline is the percentage of children under age 19 who have health insurance coverage. So it's decreased just slightly since the last time that we measured this. And of course, this is still a very high rate. As you can see, we still have over 96% of the children in our state under the age of 19 who have health insurance coverage. And although we are seeing still at high rate across the board, we're continuing to see a disproportionate number of Latinx children that do not have health insurance as compared with Black and white children in the communities. So we are still looking at ways to address the disparities that we see in coverage for children. So although the percent of mothers smoking during their pregnancy has improved overall, we do still have a lot of counties, if you look at the breakdowns, with very high rates, and some of those are over 30%. So 1 in 3 pregnancies, the mother is smoking during the pregnancy. And although it's not highlighted directly in this book, we do have some solutions that, we look at in terms of how we can help mothers with resources for cessation and to not be smoking during their pregnancy. And so one of those is to make sure we have state investments to our tobacco prevention and cessation programming to make sure that there's enough resources for anyone who wants to quit smoking to have resources to help them. So we can go to the next slide, and you can see the 2 main focus areas in the health domain this year are around oral health and mental health. So both of these we see as an opportunity to further invest and help increase the reimbursement rates for Medicaid services in both of these fields. And this, we believe, will support the need to increase providers who accept Medicaid payments for these services. So right now in Kentucky, we rank in the bottom 5 on several oral health indicators, including things like having more older adults with no natural teeth than any other state. And beyond just having a great smile, poor oral health is linked to a number of other chronic and life-threatening conditions. And so that's things like diabetes, heart disease, and stroke. So we know that there's a shortage of Medicaid providers in the oral health space in many areas of our state. And dental care can be really difficult to access for a lot of Kentuckians and families. And we see that in the numbers here, with just over 50% of children that are covered under Medicaid or K-CHIP in Kentucky that are receiving dental services regularly. So although we have a high rate of coverage for health insurance for children in Kentucky, we don't see that they're using these services regularly. And this is a pretty complex issue. So we know that not one thing is going to solve the problem that we see with oral health in our state. But there is a need to increase the reimbursement rates for the dental providers who are in the Medicaid network in Kentucky, and also expand the number of providers in that network so that more Kentuckians can receive the care that they need. And then going into the mental health space, we know that this has been a focus area, especially youth mental health in recent years. The pandemic kind of highlighted the need for more mental health care for young people. And it's a trend across the nation. Almost every state is seeing this issue, and Kentucky is no exception to that. We have 1 in 6 Kentucky teens between the ages of 13 and 17 who experience anxiety or depression. So similar to what I mentioned about oral health provider networks, there is a shortage of mental health providers in every county in Kentucky. So we know that there is a need for more providers and to be able to provide more access to care for all of our young Kentuckians. And it's especially hard to find a Medicaid provider for a lot of families that is providing mental health care. So again, investing in an increase in Medicaid reimbursement rates for those mental health services to help ensure that we have more providers and more that are in the Medicaid network for our Kentuckians. Go to the next slide. So moving into the family and communities section, we have 4 indicators here again. A couple of them related to foster care, and then a couple related to other indicators for family and community. So the first is births to mothers who do not have a high school diploma. And that has improved over time. So we're seeing less moms give birth who don't have at least a minimum of a high school education. So that was good news. The second one here is children in foster care. And we're seeing more children in Kentucky entering foster care. And then the one following that goes along with that, and that's children who are exiting foster care and are able to be reunified with their parent or primary caregiver. And so that number has also gotten worse. So we're seeing the population of children in foster care in Kentucky increase, and also less who have successful reunification with their family when exiting foster care. And then the last one on the list here is youth who are incarcerated in the juvenile justice system. And this number has improved over time. So we are seeing less young people who are engaged in the juvenile justice system. And with that, I want to just point out that although this number is improving and we're seeing less youth involved overall, we're continuing to see racial disparities with a disproportionate number of youth in the juvenile justice system being Black youth. So we're continuing to look at ways to decrease the disparities in that area and make it a more equitable system. And so one of the things we wanted to highlight here is around programming for diversion for youth who maybe get into trouble. And rather than involving them in the court system early on, we want to look at ways to continue investing in diversion programming. So we know that kids can be held accountable, but also keeping them connected to their family and community supports rather than putting them in some sort of detention program. And so as you can see from this highlight, those who are able to successfully complete a diversion program are less likely to have subsequent involvement with the juvenile justice system as compared to those who have their case referred directly to court. So again, we want to see more investments in the diversion programming because we know that is a more successful option for a lot of young people who maybe have criminal charge against them. And with that, I know that we have Lexi who was able to join, so we're going to maybe hop backwards a little bit to talk a little bit about the youth voice that you'll see throughout the Kids Count book. So we'd love to have Lexi, if you are able to, did you get your audio turned on? While we're doing that, oh, it's echoing a little bit. Well, while we're figuring out if that's going to work, if folks have questions, we would love for you to use the chat feature to ask any questions that you might have about some of the data that was highlighted here. Obviously, there's much more available in the book, so we would encourage folks to also check out other data points that were not highlighted today, and also those that are available on the data dashboard online. I'm going to wait one more second and see if she's able to speak without echoing.
Hi, can y'all hear me? Okay, hi. My name is Lexi Cox. I'm 14 years old, and I'm a proud member of KYA's Ambassador Program. Throughout the 2023 Kids Count County Data Book, you will see quotes from youth from across the state talking about their own experiences, challenges, and hopes for their future, including youth voice in the book is so important because it truly shows what our young people need and want. The data you see in this book tells our stories, and young people are more likely to listen to their peers than someone who may not understand their situation. The data in this book shows some of the issues impacting kids in our communities. Knowing more about the challenges and strong points within our communities will help us advocate for change to make a better Kentucky. Who do I pass it over to?
Back to me is good. Thank you, Lexi. So thank you so much to Lexi for joining us. And as you all can see, Lexi is featured in the book. This is just a snapshot on the screen that you're seeing of where she's featured. So we would encourage everyone to go and check out. There are some great quotes from young people throughout the book on their experience and how they would like to continue to make Kentucky a better place for other kids. And with that, I'm going to turn to the chat because I do see at least one question that has come up. Question about the data relating to after school programming. Is that only reflect programs that receive state reimbursement? Corinna, are you aware of the answer to that?
So that comes from the America After 2 p.m. report. And the After School Alliance generally covers programs that do not receive state reimbursement. So like YMCAs and ones where people can come in and out of. But I'm not sure the specific answer to if the 1,500 number is just the one that the state's aware of. But I can follow up with you on that one.
I'm muted. I didn't see any other questions in the chat, but I want to make sure we do have some space available if folks have questions or would like to speak to anything that came up for them while you were hearing the data. We'll give a little bit of time for that now. All right, I don't see any questions. If you have anything that comes up as far as questions, please let us know. Continue to use the chat. We're gonna turn it over to Emmy Lynch, and she is another young person from Kentucky. I'll let her introduce herself and close us out for today and talk a little bit more about what resources we have available.
Hello, everyone. My name is Emmy Lynch, and I'm a student at Crittenden County High School, along with being a member of KYA's Health Youth Ambassador Program. As a young person reading this book, it stood out to me that this data can tell me so much more about things I thought I already knew. In this data book, you will find tons of information on how kids are doing in Kentucky, including data about youth mental health. I learned that nearly 1 in 6 Kentucky kids aged 13 to 17 are experiencing depression or anxiety, and that speaks louder than words. You can go to kyouth.org to access 2023 Kids Count County Data Book and more information, including county data profiles, data by race and ethnicity, and you can watch videos from young people like me across the state as they talk about their personal experience to the data. We encourage everyone to use this data as a tool to talk with your elected officials, share what you learned with your state legislators, local officials, or school leaders, and join us in advocating for Kentucky kids. Don't forget to mark your calendars for Children's Advocacy Week, January 22nd to the 26th, 2024, and thank you for joining and have a great day.
Thanks so much, Emmy. And I think the last question that was put in the chat just there at the end has been answered. But if others have questions, always feel free to reach out to someone from KYA. And thank you all for joining today.